Charlie, I'm going to be working on your upper back teeth today. To numb the palatal tissue in the area, I will administer some local anesthetic first. And in order to make the injection as painless as possible, I will apply pressure to the penetration site before inserting the needle. May I have the mirror, please?
Assume the 9 o'clock position to administer a left anterior palatine nerve block. Note the slight depression in the mucosa medial to the left molar area. Use a gauze square to dry the area. Now visualize the deposition site under this depression and apply topical anesthetic to the penetration site just anterior to the depression. After allowing enough time for the topical to take effect, use the cotton applicator to apply pressure anesthesia to the penetration site, causing blanching for 30 to 60 seconds. Observe the patient for extent of blanching and for any sign of pain. Receive the syringe and immediately place the needle tip at the penetration site and direct it toward the canal which contains the anterior palatine nerve. Once under the hard palatal tissue, aspirate. No blood appears in carpule, so proceed to deposit 2/10 to 3/10 cubic centimeters of anesthetic solution slowly over a period of 10 to 20 seconds. Observe the surface area for extent of blanching. Watch for any swelling that might necessitate terminating the injection. Withdraw the needle and resheath it.
Would you turn towards me, please, and I'll rinse out your mouth?
Wait 1 to 3 minutes for the anesthetic solution to take effect.
Please open again.
With the rounded back of an explorer, press against the palatal mucosa adjacent to the maxillary left molars. The following dissection can help make clear the location of the anterior palatine nerve. It emerges from the anterior palatine foramen about 1 centimeter from the lingual gingiva crest toward the midline of the palate. From the same foramen, blood vessels enter the canal in the hard palate together with the anterior palatine nerve in its numerous branches. Now observe the anterior palatine nerve block administered on a skull. The needle approaches the penetration site from the opposite maxillary premolar area so that it will be as nearly at right angles as possible to the tissue at the penetration site. The solution is deposited just anterior to the anterior palatine foramen. Consider the clinical situation again. In this mouth, the slight depression in the palatal mucosa, about 1 centimeter medial to the molar area, indicates the location of the anterior palatine foramen. Visualize deposition site under the depression and apply topical anesthetic to penetration site just anterior to it. Enough pressure should be applied to cause blanching. As applicator is withdrawn, note increased size of the depression. Receive the syringe and rest barrel on opposite premolars as you place needle tip at penetration site, so that some solution is deposited ahead of the needle as it advances. After penetration, maintain slight pressure on the plunger. Perform aspiration test when needle is at deposition site. Deposit drop by drop. Because of the relative tightness of the tissue in this area, a drop of solution may appear on the surface or be expelled from the needle tip upon withdrawal. The solution tastes bitter, so the mouth is rinsed.
Would you turn towards me, please, and I'll rinse out your mouth?
Allow 1 to 3 minutes for the anesthetic solution to take effect before testing for anesthesia.
Open again, please.
Test for signs of pain sensation by pressing the rounded back of an explorer against the palatal tissue of the molar area.